A shooting occurred at the Regional Medical Center's emergency department. The shooter presented at the emergency department at 7:29 this morning and eloped from the emergency department at approximately 8:30. The treating physician and the nurse did all that they could to contact the patient, but was unable to reach the patient. The individual did return to the emergency department at approximately 8:50 with the weapon and began shooting inside the emergency department. The Orangeburg County Sheriff's Department was notified immediately and responded within minutes. The suspect was quickly apprehended. The hospital immediately issued a code silver and locked down the hospital while law enforcement conducted a room-by-room search to ensure the safety of all patients and visitors. A regional medical center employee and family member was shot and underwent surgery immediately. At this time, this patient is in critical condition. Our prayers are with him. Our prayers are with the family. Our prayers are with all the members of the Regional Medical Center team and the Orangeburg and Calhoun community. The hospital has been returned to normal operations as of 10:45 this morning. We have done all we can, and we have employee assistant program counselors here and chaplains working with our staff as needed. The emergency department remains locked down and will not be reopened until 3 p.m. today. If you have any questions, I will take them at this time.
Can you tell us a little bit about the employee, how long he's been here, or maybe what capacity he works?
Well, due to HIPAA rules and regulations, we cannot give the specifics of our patient for his or her identity.
Was this suspect coming for treatment here at the hospital?
Yes, the suspect was a patient, and he eloped. He left on his own, and we did all we could to keep him. He left, and he came back.
How quickly did they apprehend him?
From all that we know, ma'am, within minutes. And when I say minutes, I mean less than 5. And I want to truly commend the Orangeburg Sheriff's Department. They were here quickly, and we are so thankful for their partnership and the partnership of Sheriff Ravenell.
What I would say is that the call came in to our dispatcher at 8:51. Myself, Deputy Clinton, and Sergeant Parks arrived at 8:54. When we arrived, we proceeded to the emergency room where the security guard, where the suspect had surrendered himself to the security guard as we were entering. So the security guard that was here did a great job. Also, a great job was done by the person that called 911. They stayed on the phone with dispatch and gave all the information that we needed to know that there was an active shooter and that he was still here in the building. After that, we cleared the building, make sure everyone was secure along with the hospital team. And at this point, like Mr. Williams said, it's still an ongoing investigation, very fresh. I can tell you at this point that the charges are assault and battery with intent to kill, 1 count at this point.
Representative Gilda Cobb-Hunter spoke earlier on the State House floor about this incident, saying that it had to do with the mental health of the individual who was the attacker. Do you want to comment on that at all?
No, I do not. I think what is most important at this time is that we all pray for the individual who is lying in a bed right now wanting to be healed. I think it's important that we come together, that we work together to ensure that things like this don't happen. And if they do happen, we have the response like we had today. As I said earlier, we had a response within minutes. Our in-house team was able to take this person into custody quickly. And thankfully, we had local law enforcement that was here in less than 3 to 4 minutes. That is amazing teamwork. It's not something you want to experience, but I am thankful that we have people that are working and prepared in a proactive way to promote a safe environment for all those that seek our care.
A few people earlier out in the parking lot as well was saying that this is not the first incident that's happened here at the hospital. Has there ever been another shooting here in the past?
That is an excellent question, and I thank you for asking because I saw that myself. This is the first time. I don't know where that individual got their information, but we have never had a shooting like this on this campus.